We now proceed with our second keynote address. I request Chairperson Dr. A. Sam Tambaduraj, Principal, VMCPT, Salem, to chair the session. Welcome, sir. The second keynote address by Dr. Rajkumar Krishnan Vasanti, Senior Lecturer and Head of the Program, ICTIH International University, Malaysia, who will be presenting on the topic, Innovative Digital Approaches to Strengthen Patient-Centered Care. Welcome. I request the chairperson Dr. A. Sam Tambaduraj to address the felicitator.
A very good afternoon to one and all present here. It's indeed a great pleasure for me to welcome you for the post-lunch session for the first day of the International Conference. And it's my privilege to introduce the keynote speaker of today, Dr. Rajkumar Krishnan Vasanti, who is a Senior Lecturer and Head at INTI International University, Nilai, Malaysia. He has an extensive experience in academic leadership, teaching and curriculum development in higher education. In his role, Dr. Rajkumar oversees the departmental academic activities which actively contribute to teaching, research, and student mentorship. His academic interests focus on advancing quality education through innovative pedagogy and interdisciplinary learning. He is committed to fostering academic excellence, industry relevance, and global perspectives within the university environment. Today, he is here to speak about innovative digital approaches to strengthen patient-centered care. I request Dr. Rajkumar Krishnan Vasanti to take the floor.
Thank you, sir. Very good afternoon to everyone. My name is Raj. Thank you, Dr. Sam, for a brief introduction about me. Before I proceed into my today's sessions, I would like to thank Vinayaka Mission, Vice Chancellor Sir over here, for giving this wonderful opportunity for me to be here, and also Professor Dr. Gnanasekar Sir for graciously inviting me to this wonderful event. Okay, so in next few minutes, I'll be sharing you some of the insights what I came across on the digital interventions, which will be the future trends in healthcare sector. Okay, so this digital interventions will be moving from a traditional where the hospital-centered care towards the patient-centered care. Because nowadays patients, we keep them as a core preference for whatever the treatment or whatever the therapy we are giving. It has to be based on a patient-centered approach. So in order to deliver this patient-centered approach, we need digital technologies to come into the picture where it can take over many of the activities or the procedures what we currently handle by humans. Okay, so if you look into the healthcare transformations, we all know that we need the healthcare sectors to be accessible and convenient, right? So we need that. That's our foremost preference. It has to be accessible. Everyone has to have a good healthy care, and also we need a convenient care, because sometimes it will be accessible but it's not convenient. Sometimes it is feasible for the patient, sometimes they are not able to visit the centers or tertiary hospitals, they may be in the rural sectors. So how we can overcome all these challenges? So that's where this healthcare transformations is going to take place or taking place now, and in future I think it's going to be really helpful to overcome many challenges according to what World Health Organization has been put forward. Okay, so we all know that worldwide the elderly people are increasing drastically, right? And also because of the elderly people booming up, so we really need to know there's a lot of prevalence of chronic diseases which require continuous management, or it requires continuous care. So that's why I was informing you guys just before that accessibility is very important, because of the rising healthcare costs and also need for the efficiency. All these elderly people, sometimes they are not able to afford, or sometimes they are not able to access the care which is really in need for us to deliver. Okay, so that's there where if you look into, there's a greater patient's expectations for a personalized and engagement care is very important. Okay, so that's where the technological advancements it's creating new possibilities to overcome these challenges. Okay, so when we look into this digital technological or digital interventions or technological interventions, we have to look into what are the possible ways. Basically, if you term that, they call it as digital health or digital technologies for health. Where this terms comes from? This terms basically it's nothing but where the engineers are looking for or studying. It's all based on the use of information and the communication technology to support health and health related fields. So where the engineers need to build up new future technologies so that we can easily provide accessible and a convenient care for the patients. Okay, so if you look into this digital health, where we can use mobile phones as a minimum device to provide technological tools to the patients to deliver the healthcare related problems. Okay, so and also we can use telehealth, or we can use a remote patient monitoring. So this remote patient monitoring, it's going to be the future, and even in some places we already incorporated this remote patient monitoring. Okay, and machine learning systems, artificial intelligence, and we even look into the morning sessions. They are speaking about robotics, virtual reality, augmented realities, and also we have extended realities. So this kind of technologies, it's going to be a game changer for the future healthcare sectors. So, and we already need to think and plan how to incorporate this into our field in order to provide, as an engineers, in order to provide or to build the new application systems for the futuristic world in terms of the healthcare sectors. So this is the rise of the patient-centered care. Why I'm speaking about patient-centered care? Because every patient nowadays, they are expecting many things. So one of the main important things is respects for the patient preference, because every patient is not similar, right? They prefer something specifically. They want an individualized plan, individualized treatment, or individualized approach for them to get better and faster cure of whatever the problem they are facing. Okay, and also they want to share the information conveniently, safely. Okay, so and also they want to have the shared decision making. Okay, it's not only in, if you say in previous quite long time before, where it's through one way, right, where the doctors or the physicians or the therapists will deliver what the patient has to do. But nowadays the patient is also preferring what they want to have. Okay, so that's, we should have a shared decision making, emotional support, and also physical support, continuation and transition of the treatment, and also access to care. So this is the basic need which is rise nowadays in terms of patient-centered care. So how we can provide this rise of patient-centered care? The one of the basic tool or one of the common tool in nowadays which we can use is the digital technologies. Okay, so this digital technologies, it's going to overcome all these issues what the patients are expecting in this world. Okay, so that's why we targeted for this digital health ecosystem. The reason is to have a synergized goal, synergized feedback, communication, and also to give a proper engagement for the patient. Okay, so if you look into the WHO, World Health Organization, they have already said that we have to move from the traditional to the digital ecosystem. Okay, so why we have to move from the traditional to the digital ecosystem? Because we want to give a quality and the coverage of health systems or health interventions, because we are facing a lot of health system challenges. In order to overcome all this digital health interventions, it's really going to help in many ways for the patients. And not only for the patient, it also saves time as a physicians, as a physiotherapist, or as a rehabilitation people, or any healthcare sectors persons who really need to overcome this health system challenges. Like for example, poor demand of services, okay, failure to follow up guidelines by the patient, and commodity stock, insufficient workforce, inaccessibility to the facilities. Well, these are all the things sometimes we will be facing if you want to get a proper treatment or proper therapy. So in order to overcome all this health system challenges, we have to develop a proper digital health ecosystem. Okay, so that digital ecosystem will provide a greater control and also will provide a greater convenience for the patient, better understanding of the patient's problem, and also it will help us to have a proper enhanced communication, to give a personalized support and adherence of whether the patient is adhering to whatever the treatment protocols which has been delivered to them. So we can monitor from remotely, and also for early detection where we can use like machine learnings, artificial intelligence, where we can really learn or early detect the problems occurring, and also to reduce mental well-being. Okay, so this is all the different areas where how we can move from the traditional to the digital ecosystem. Okay, so we all discussing in this morning like robotics are coming into picture now, and where we need to change the world by using this digital ecosystem. So when that's what we are in now. So when you look into, we are in the Industrial Revolution 5.0, where we are moving towards humanized touch with the robots. It's not only robots is going to take over everything, where we are as a human will be having a touch on that, and that's where the technology has revolutionized from few centuries before and to current, where the human robots are collaborating with the cognitive system and also customization with the human. Okay, so this is what happening now, where we have to embrace this and we have to provide a care to the patients. Okay, so and this can overcome like what are the things which I have just now informed you guys, health system challenges. This can overcome. Okay, so if you look into the Industrial Revolution 5.0, it's nothing but it's a human-centric approach where it envisions the technologies like artificial intelligence, robotics, and enhanced collaboration between, like I just said, humans and the machines. So leading to a personalized treatment. Okay, treatment plans, and also to have an improved efficiency of patient outcomes and to have a better quality of life. Okay, it's not only for the elderly people, it's for any age group. Okay, I'm concentrating more into elderly age group, where our world is moving towards elderly nation, right? And even in India, we are moving towards increased elderly population as well, which we will be seeing. Okay, so that's what like which I shared to you guys. Industrial Revolution will take many future jobs to provide a personalized, transparent, convenient, and on-demand services. So this says that we as an engineers, we have to develop many products, affordable products, applications to embrace these digital technologies for the patients. And even WHO recommends that digital intervention will have a potential to strengthen the coverage and also the quality health services for various patients. Okay, and medical services are also included in this as a usefulness and also the convenient for the patients in many countries. Okay, so this is going to have a benefits to overcome the challenges what the patient has been facing now. So how to develop this digital ecosystem? So it's to develop this digital ecosystem, it's not that easy because we need to worldwide or nationwide, countrywide, we have to develop this digital ecosystem. So where from organization-centered healthcare model, we have to move into patient-centered care. Right? So nowadays, I mean not nowadays, we already started moving towards the patient-centered model, but we have to embrace or incorporate into many aspects which we have to look into. Okay, so from just an organization center. Okay, so how we have to do this to bring this digital ecosystem when you have a look. So the foremost thing which I would like to inform you guys is the e-health governance. So it has to start with the national or regional or even with the global e-health coordination tools where there should be a proper rules, regulations, protocols has to be set from the government level or according to the universities or whatever the governance, whoever governing that specific related products. Okay, and also we have to store this electronic record. So we have to know where we have to store this, and we have to know the standards and the interoperability procedures. Okay, how we are going to communicate between different technologies and software applications using the standard for an effective, accurate and reliable exchange and use of data, and how safe. So these are all the things which we have to look before we develop this digital health ecosystem. I said like telehealth, telemedicine, M-health, and also we have to literate everyone about the digital health literacy. That's very important. We are all using mobile phones now. We all know we can do many things with the mobile phones. So that's what I said, mobile phones is a minimum digital intervention tool where we can concentrate or we can utilize. That's maybe a future as well. Okay, so if this digital health literacy like set of skills, knowledge and attitude is very important because we need to change our mindset. We can't think like, oh, I don't want to change. No, it can't be like that. We have to have a mindset of to accept the changes, how the trends are moving towards. Okay, that the attitude of the person that needs in order to develop the functionality and also the information society is very important. Okay, and social networks, of course, to expand our products, the digital ecosystem, we should have a proper social networks, and we also can use the big data to the unconventional data, we call it as, for decision making in public health. Like just now in the morning, we have had sessions by our keynote speaker, like Anurag, like he was doing on this big data collections and providing the solution for the therapist. Okay, so that's why this digital ecosystem is very important, and we have to plan properly on this digital ecosystem. We have to have a proper networks and proper collaboration with different organizations to get various inputs and the necessary product for the necessary products to be developed. Okay, and who is targeted for this digital ecosystem? It's not only the clients. Clients, of course, they are in the center focus, but also the health workers, because they are going to deliver it, and also the data service where the engineers comes into the picture, where you guys will be storing this necessary information, and you guys going to support as a technologist on this system, and also all the healthcare sectors where the managerial role, people who is maintaining or managing the healthcare systems and the resource managers are involved in administrating and oversighting the system, because supply chain management, health financing and human resource management. So these people also will be taken into an account for this targeted health ecosystem, okay, digital ecosystem. So is this digital ecosystem is possible? So we will be pondering, oh, sometimes it cannot be feasible for us, or it's very difficult, or whether we can use it or not, whether everyone can access or not, or the elderly people can use it or not. But now we know already, I said mobile phone is a minimum device which we can use as to deliver this health. Okay, so in order to prevent or in order to overcome the challenges faced, is this possible? Yes, it is possible, because we can see how the internet has penetrated and how many people are using. So these are some of the facts which you can have a look on it. Okay, so if you see worldwide, there are about 4.6 billion people who are active internet users. Okay, this is quite few years back, like 4 years back, the survey was conducted. Okay, and also if you see what is the percentage of the world who has internet access, we have 65% of the people who has the internet access. Okay, so this is the main two things which is really in need to deliver the digital healthcare services easily through mobile phones. Okay, so this I already has shared with you guys, nothing but how we have seen the trends of this digital technologies, or the technologies has been moved from various eras, like from the telephone, pre-recorded videos or which we used to watch, and then it moves to the live videos and smartphones, Internet of Things applications, which is becoming old now, and now we are already into robots, AI, chatbots. We ask the chatbots, so chatbots giving the basic information. Sometimes we may not able to provide all the relevant informations for us in healthcare sectors, but to certain extent we can use this chatbots or AI or the robots which can deliver you or to support you to certain extent on the healthcare system. Okay, and is there any need of this things? Yes, of course we are looking into a greater picture, because the world is moving towards elderly nations. Youngsters, we can easily have the accessibility, we can travel maybe like whatever the kilometers is to the hospitals. But if you look into the elderly people, they can't travel much. So how we can provide this kind of healthcare services to this elderly group? We have to look. Why we are looking into this elderly group? Because if you look into the statistics, elderly people will make 22% of overall population by 2050. So this, it indirectly says that the accessibility is going to be a challenge for the patient, and convenience care, it's going to be a challenge for the patient. And also if you look into how to say, even in India, we are moving towards elderly thing. Okay, so the shift of global demographics towards the increased elderly population is tremendously increasing. And also if you look, there's a 58% reduction of cost in comparison of inpatient rehabilitation. It's going to be the benefit of using this digital intervention technologies. Okay, and when you look into the need of rise in India, of course we know India is an younger generation, but behind the scene there's India is also becoming elderly, but not when compared to other countries, but in terms of the populations we have, we also, it's going to by 2050 we may have about 347 million people it's going to be senior citizens in India by 2050. And also these are some of the facts which you can have a look, because for us to predict and to prepare for the future, how to provide a convenient healthcare, and also to overcome the digital health challenges which is going to be faced by many of our elderly people. Okay, so this is where we as an youngsters or in future youngsters like you guys has to be ready to embrace the digital technologies more, and to provide or to develop new technologies, new tools which can easily provide an accessible and convenient care for the patient. Okay, you can see over here, these are the general facts where you can even get it from Google, you can check it as well. Okay, and this is also some of the facts state-wise. If you look into even Tamil Nadu, we are going to be the second largest elderly population soon, okay, by 20%. Currently, Kerala is number 1, which is 22.8%. So we really need to look all these facts, okay, why the need to rise of this digital intervention. So we really need to look on this. That's why I'm just projecting all this kind of basic informations, so where we guys can embrace this and provide a proper technological information to develop a good application system to provide a better care for the patient. Okay, how to build this digital engaging system, digital interventions? We have to not only just build, we all know that, right? So we have to identify the management drivers, like the theoretical underpinnings, like what are the facts, what are the need. We have to underpin all these things, theoretical informations, cumulative it, and we need to find the need and rise, and we have to develop accordingly the proper drivers. And we also have to fine tune with the user testing and co-design it to develop to engage it. And not only with that, we also must make sure we quantitatively or qualitatively measure the real world success, and also get the feedback from the end users. That's we call it as measuring the outcome of what we have developed. Okay, so in order to build a proper engaging digital intervention or digital tools, we have to make sure this kind of system you have to build in yourself and make sure to enhance the system for a betterment of a good product. Okay, so that's, if you look into the recommended digital health interventions, who all the people or who we can incorporate this digital interventions. When you look into this, we can see it can start from client to provider, and we can see provider to provider, because provider to provider means like physician to physician, or any therapist to therapist, because to group discuss, to give a better treatment or to discuss. So we can use this digital technologies. I think we are already using that. And targeted client communication, specific patients where we really want to communicate with them. They no need to come for basic informations or basic checks to the hospitals or to the clinics or to the centers, where we can use a proper digital ecosystem where we can communicate remotely with them. That's it's going to be the future. And also to have a proper healthcare, worker decision support. So as a group together, we decide what decision we want to make to the patient. So we no need to come physically. This can happen through online, okay, with a digital system. Digital tracking of the clients, how the tracking in the sense like whether the patient is adhering to the specific treatment what we have provided. Okay, even like as a physiotherapist, if you look what are the exercise, if you have a specific exercise, whether the patient is following the specific exercise or not. For simple exercise, they no need to really travel far away or far to the hospital or to the rehab centers, but we can remotely monitor them. So to develop this digital ecosystem, we need to prepare or be ready to accept and also to develop this kind of digital ecosystem. That's going to be the future of the world. Okay, and also for educational purpose and also for training purpose among the healthcare workers, these digital interventions are highly recommended to develop, and also we can embrace them into our practice. Okay, so that's I was discussing, like that's going to be the futuristic model, right? So let's explore how the technology is shaping the future in healthcare, and also we also have to remain thoughtful, open-minded and optimistic. Okay, so before we proceed into any digital ecosystem, we also have to raise the questions within ourselves or to the patients, whether in terms of these 5 areas, evidence consolidation. Number 1 is the effectiveness. Whether whatever the products which we are, or applications which we are developing, we must make sure what is the certainty of the evidence on the effects of the product which you are developing or creating. Okay, and also you must know whether this kind of product is acceptable by the patients or the end users. Okay, here since we are in healthcare, end users is our healthcare people, I mean the patients. Is this the intervention or the option acceptable to the clients or the health workers, the physicians, even any of the physicians or the healthcare work, any healthcare workers. And also we have to make sure the feasibility. Is it feasible for the relevant stakeholders to implement this kind of intervention or this kind of model, whether it is feasible or not. So in order to make it feasible, of course, one of the major thing which we will face for the feasibility is the cost. So we have to develop a product which is cost effective and also it's a valid product, right? So we have to look into all this evidence consolidation and also the resource use, cost effectiveness, which I was telling, and also the last, gender equity and also the rights. Okay, so to protect the legal aspect. So we have to know all this evidence consolidation to be into the picture where before or developing any applications or a product to have a proper digital health ecosystem. Okay, so with that I think we will know already the benefits of digital interventions. It's going to be extremely cost effective. Even we are discussing in this morning sessions with the panel discussions, like they are discussing like robotics are going to cost about 10 crores more than that, and now we are coming into 70% reduction or 1/3 of reduction in many key surgeries, products, robotics, right? So it's really going to be extremely cost effective for the affordable surgery for the patient. Okay, and also we have to, if you look into this Internet of Things and digital interventions, where at the same time we can increase the access of users. That means the patient waiting time, waiting period for simple consultations, it's going to be reduced. Okay, and also it's going to be infinite number of times can be used by the users, right? Because it's going to be internet, it's going to be through mobile phones. So many people, same protocols can be utilized to certain extent, but sometimes we are really in need of individualized approach. So we have to see certain things which can be generalized, certain it has to be individualized. So we have to look into according to the patient needs and we have to provide. So it can be done. Okay, and also to provide prompts and alert based recording to the protocols, because sometimes we are not sure whether the patient is elderly patient, for example. They are in the remote areas. We are not sure. We just prescribe, follow up these procedures or protocols at home. But whether they are adhering to that or not, we are not sure. So where these digital tools can monitor them, whether we can have a proper set of prompts, maybe at 10 o'clock or whatever the afternoon or evening, whether they have taken the medicine or whether you all need to have a consultation or we really need to explain some exercise prescriptions. You can provide it through prompts, okay, like a ringtones, alarm, something like that, or you can digitally come, or the robots comes into picture, call the patients and discuss whether they have done the necessary things that had to be done or adhered by the patient. And also by using all this digital intervention, practitioners can, healthcare practitioners can really focus on more complex tasks rather than a simple task where we no need to engage with the patient. Okay, and also for the proper communication and a good performance feedback can be get through this digital interventions, and this can easily provide you a lower number of admissions or readmissions in the hospital. Okay, so that's really going to help the patients, because I said already, it's a patient-centered approach. We are moving towards patient-centered approach. Okay, and also provide checklist according to the protocol to the system, and whether the patients are monitoring or adhering to the certain protocols or not, we can do it through a digital or through the remote monitoring system. And last but not least, scheduled healthcare providers activities also can be utilized into this digital interventions. Okay, so with this I would like to conclude saying that we all know that digital systems or technologies, it's going to be the ever enhancing realm of technology, and it's going to really evolving changes in, we will see the evolving changes in technology to make an interactive environment with the patient. Okay, so that's why you guys are there to come up with new products, new enhancing or engaging products with the patients. Okay, and also new phase of applications that can facilitate patient communication, patient adherence, or patients whatever the necessity the patient needs. Okay, and the last were the novel healthcare applications and the effect of patient behavior change, and also the patient experience can be fulfilled or can be enhanced by using this digital technologies. So with that, I would like to say that digital technologies or digital interventions, we called it as, it's going to be the futuristics model of the future world. And we already started embracing it, like even some surgeries in the morning we discussed like 50% already embraced. In future, it can be go beyond percentage of the 50-50. Okay, but it doesn't mean that the total robotics or everything going to 100% take over. That's where now we are in the Industrial Revolution 5.0, where the human touch is necessary in terms of healthcare sectors to provide consultations or proper healthcare sectors. So where we are going to be the in lies with the robots, we call it as a humanoid things. So we to provide a proper, convenient, quality, accessible healthcare, and also to overcome the various healthcare system challenges which we are facing according to WHO puts on. Okay, with that I would like to say thank you again for Vinayaka Mission for giving this wonderful opportunity to be here. Thank you. Any questions?
Dear participants, the floor is open to raise your queries and get clarified.
So what are your views on the ongoing and upcoming wearable healthcare devices?
What is that?
So your views on ongoing and upcoming wearable healthcare monitoring devices?
Upcoming?
Wearable healthcare device.
Various healthcare device. Wearable healthcare device. Yeah, of course, because wearable healthcare, because digital interventions, wearable healthcare device, it's a part of our mobile phones nowadays, right? So of course, any devices, you have to be make sure. Currently, we can monitor the heart rate. Currently, you can monitor the basic information. In future, it can be beyond that. Like even in the morning sessions, we are discussing about the neurolinks by the Elon Musk. So where it's going to control many things. Artificial neurons, it's going to develop, which can easily connect your spinal cord injuries. Now, currently, spinal cord injuries where we can't replace, but there are neurolinks are going to happen where